Good afternoon, Matt. Thanks for coming in today. Good to see you today.
You too.
How's the pizza business?
It's doing great.
Fantastic.
Oh yeah.
We love it.
Oh yeah.
So you came in to me on a referral from a patient that had some upper and lower roundhouses done.
Right.
And I think it was your desire to have teeth that were more natural rather than dentures and things like that.
Yes, and coming from Amy and talking with her, I knew what she had problems with.
Yeah.
And so I didn't want to go that route. I wanted to do something, obviously, that felt more natural.
Yeah, very good, yeah. So we showed you this model, and this is the model that we use all the time with our patients. And take those teeth off for me.
Okay.
We talked about the implants going in just like the roots of your teeth.
Right.
And then being able to put a permanent bridge work on top of those, cemented in place so that they fit and looked and acted like normal teeth.
Oh yeah.
Yeah.
And it's, for me, okay, all parts, the whole journey was excellent.
Oh.
I've never been to such a good dentist in my life, and I honestly feel that way. Like, from all the visits, they always made me feel comfortable. And then at the finishing product, to have the teeth and to be able to smile and to be excited and show my teeth off, and for once feel like I'm the center of attention and not trying to hide it. So yes.
Right. I know that during the process we had to take the teeth out, but allowed some time for healing. And we used what we call a first temp, which has teeth in it, fits over the place where we had freshly put the implants while they healed in.
Right.
And the gums have to heal. And when we finally get a good healed pattern, then we can go ahead with this process so that they fit better in the long term. So was that experience okay?
You know, it was. Well, you guys explained everything to me, so I kind of knew what to expect and what not to expect.
Yeah.
And so it's an all-out journey, but it's a journey that's well worth it.
So what haven't you been able to eat?
Well, I don't chance eating like gobstoppers and trying to certain things that would get me back to the old style again.
Yeah, for sure.
But to be honest, I don't think there is anything I can't eat. I can eat ribs now like a normal person. I can eat corn like a normal person.
Yeah.
Pizza like a normal person.
Yeah,
I mean,
good.
Sounds crazy, but getting to eat it like normal is great.
Fantastic. Well, we've appreciated having you as a patient, and we're hoping for long-term success.
Oh yeah.
Okay? And Matt, thanks so much for coming in today.
And if I can say one thing, you gave me probably the best thing that's ever happened in my whole entire life, other than getting married to my beautiful wife and having 2 wonderful children. But
thank you so
honestly, from the bottom of my heart, thank you.
Thank you very much for that.
Thank you.
I appreciate it.
Thank you.